The next discussion I'll be making I'll be talking about Omphalocele and Gastroschisis abdominal wall defects. So talking about Omphalocele and the rest is it's more of like you trying to talk about the differences between these two medical conditions. Alright, so it's just simple. We'll discuss them one by one, then from there you guys should get to figure out the differences. So Omphalocele and Gastroschisis, there are two major congenital abdominal wall defects. They are seen in newborns, that's neonates. Okay, so they are often confused, so that's why we're actually discussing them together. Okay, so that from the discussion together you can actually get to figure out the differences. So Omphalocele now. Omphalocele is an herniation of the abdominal viscera into the base of the umbilical cord, but is covered by a sac. Something is still covering the intestinal contents. Do you understand? So what's the embryological reason? There's failure of midgut to return to the abdominal cavity during development. So contents that are actually coming out of the stomach, you have small intestine, you have the liver, other organs could follow too. So the sac covering it is the amnion and the peritoneum. Okay, so it's very common. It's associated with things like all those trisomies, Beckwith-Wiedemann syndrome, cardiac defects too. So management is stabilization, NG tube, IV fluids, antibiotics, everything. How about gastroschisis? Is herniation of the abdominal contents through a paraumbilical defect. Okay, so embryology, there is failure of closure of the lateral abdominal folds. So contents that are out is usually small intestine mainly. So nothing is covering it. In gastroschisis, right, the contents are out and nothing is covering it. So usually what occurs in isolation, there's no associated syndromes. All right, so management is still same. Stabilization using nasogastric fluids, intravenous fluids, antibiotics. Okay, they protect the bowel with a sterile, warm, saline, soaked dressing. Okay, then they can surgically repair it later. Sometimes they allow the stomach to develop for some time, then they push it back. So that's what we got for this.